Greetings, this is Dr. Milady with the Nursing Edge podcast, here to provide you with tools, tips, and motivation to start your nursing career and to advance to your greatest potential. I did it, and so can you. So today we're here to discuss what are some of the deterrents to not starting our nursing career. I think the number one thing I would say is anxiety. I mean, when you start anything, what is the biggest thing? The fear of getting started and the fear of failure. So, the first thing I would say is anxiety or nervousness about starting something is a normal feeling to have. If you've never done something before, of course, you're going to be somewhat nervous about it, not knowing what you're getting into. We're going to kind of break down some of those intricate pieces of anxiety sometimes that holds us back. And a lot of times it may be cost, whatever it may be, we're going to break that down. Anxiety, as I said, is a normal feeling. If you do not have anxiety of doing something, especially at my age and also younger, what you see people on TV doing this and that, you see the dramatization of it that, oh my God, all this blood and guts, and it's like, this is what I'm going into. Not knowing whether you're going to pass, all these different things, or not knowing where the money's going to come from to get started. So all these, again, are normal feelings. And we'll talk about, as we discuss things, how to go beyond that. I think the fear of failure, I think, is what stops most of us from getting started. Failure, to me, is not a thing. I don't know how to, well, I'm going to explain that. I'm going to attempt to explain that. Failure may be, to me, not getting started at all, right? If I do not do well in something, I do not consider it to be failure. I consider it to be, okay, where there's more I need to learn about this to be successful. If I do not do well, I push myself and find other ways to improve in this thing. But while I am improving, I'm also learning from the fact that I maybe did not do well in it for this reason, that reason. It's finding out what is there to learn from having not succeeded in something. So let's put it that way. And every time I didn't do well in something, I have learned more for the next thing and to be able to do better at it next time. So that, to me, translates into a learning opportunity. So where somebody may look at the cup half empty, I look at it half full. How can I do better at this? And I have had situations that I can think of. One in particular where I will talk to you about this at a later time, where I started an aspect of being a nurse practitioner, which I stumbled. I can tell you I quit at a particular job because I was anxious. It's a different situation. I would say it's a different situation in my life. It was a time of change, too many changes at the same time, which I will discuss later on. But I want to stick at sometimes you may need to take a step back. And that's exactly what I did in this situation. I took a step back, recalculated, and then took whatever I learned from that and moved forward. So I'll leave it at that. So not to confuse where I'm at right now. I'm trying to stick to the script. Okay. So we talked about fear of failure, fear of not knowing enough. Again, if you don't know a field well, let's say you've never, ever done anything in nursing, you have never been a CNA, you've always thought about and being intrigued about this field, but never really, had a job in it or, been around people that were in nursing to really know what it's like to be one. So there's always that fear. And how do we get over that? Well, it's either finding somebody who does this for a living and asking them all the questions you want to ask, getting a job that introduces you more to nursing so that you're not fearing the unknown, right? And sometimes knowing too much about something can also make you a little bit shy about getting into it. And the fear, not just the fear of the unknown in this case, the fear of this looks difficult, right? So the difficulty to me, how do I overcome that? I learn more about it. Something looks difficult to you because you don't know enough. And very often I see stairs and not mountains. Stairs, I can step up one by one, and I get to the top. But when we're looking at a hill or a mountain, you start to think about, oh my God, I have a lot to climb. I mean, it seems so tall, right? It's a tall order. But it all depends on how you look at things. Like I said, I try to look at the glass half full and not half empty. So that if you are the kind of person who's more of a pessimist, I urge you to think of things that are smaller than they appear so that you can try and overcome them. All right, the next thing we're going to discuss, fear of not liking school. Some people, when they got started, they were younger. And, when you're in school and it almost feels like you're being forced, let's say in high school, some of us may have felt that we're being forced to get this education. We have a tall order. And once we're out, it's like freedom, finally, right? But as we get older and we start to realize that, well, this thing in terms of education does help me to further myself and also economically can bring many more opportunities. Not to say people cannot necessarily go to college to be able to have those opportunities. And like I said previously, college may not be for everyone, but it gives you greater opportunities for advancement. So especially in a career like nursing, there are so many benefits to going into it. And that's what I hope to express to you guys so that you have a greater understanding of why I went into this amazing field. Okay. So again, not liking school. Some of us, even as we are older, we had trouble retaining information, or we had difficulty just with the way things were taught. And I urge you to, if that was you when you were younger, to really think about, as an adult learner, you may be in a different mindset. You're in a different time in your life where you're more receptive to learning. And and for me, nursing primarily, I had to think about it as, if I have a family member who is not feeling well, has an issue, a chronic medical condition, even if it is something like high blood pressure or diabetes, especially, many of us have family members who deal with this sort of thing. When I take them to the doctor, do I understand exactly what the doctor is saying? Even if they try to say it in layman's terms, do I really comprehend taking the blood sugars at intervals in the morning, evening, that sort of thing, understanding what that blood sugar means to this individual, especially if it's a parent or a loved one, and they may not necessarily understand all this, medical lingo, but can I help them? Many of you may not necessarily have ever worked in any kind of nursing setting, but you have somebody at home who you've been nursing for a very long time. And a lot of this information you're very familiar with when we talk about BP as opposed to saying blood pressure, when we're talking about the blood sugars and what low and high mean. So you do know a lot of this information already. It's putting it into proper context, not just for the loved one, but for other people. So again, when we talk about learning styles, you start to figure out what your learning style is. And if you need to, and most of us need to put things into the proper context to really get it. I'm one of those people. I'm an auditory and visual learner. I need to be able to hear the information and also apply it to real life to be able to get it, right? And also get my hands involved in things. And as we get older, we need to do this thing repeatedly, and to keep it to memory, right? So the next thing is that I wanted to discuss with you, but I'm going to discuss this in another podcast because I want it to be specifically about how we find the money. The anxiety of how do we pay for this thing? We hear about how much it costs. Different people tell you, oh my goodness, I paid this much. That is going to be for another podcast, and I hope to be the very next one, if not the following, to discuss the main thing: where to find the money, where to find the resources. Well, I'll have that for you in another podcast. So today I'm really talking about mainly the anxieties that keep us from getting started. So keep in mind, of course, money is always big, right? The next thing I wanted to discuss is age. Whew, age. So where do we go? How do we start this thing, right? After high school. And some of us either would like to go straight from high school, starting that. Many of the high schools now have those CNA programs, those programs that are medics, where they can become paramedics, and various CNA programs. And there are others that also train in medical assisting. And they have these internships that are absolutely amazing. So in our clinic, we do train, I train just about everyone, medical assistants. CNAs are primarily not in the outpatient setting. They tend to be bedside. So not so much those individuals, but great places to get started. But getting back to the age, many of us are getting into this after years of being out of school. And you say to yourself, oh my, it's hard for me to remember what I did yesterday. How am I going to focus to do this? Now, for those of us who did not like school because we were not able to focus, many of our adults are finding out that they have attention deficit and they had trouble in school all along because it was not recognized and not properly medicated. All right. Many of us find this out as we are at work at other jobs and we just can't keep our mind on something, or we start to read something and, by the time we get to the end, we can't remember what we read. So even if we were to read it again 2-3 times, we still cannot get the gist of what we read because our attention span was short and we're not able to keep on a task. And too many things are traveling through our minds that we cannot grasp the information. That's how people have explained this to me, that it's just a lot is running through their heads and they're not able to grasp it. So for those people, I highly recommend that you see a medical provider. Some primary cares do treat for adult ADHD, but for most practices, they may not, and they refer you to a psychiatrist, and that's absolutely okay. Typically, they may want you to see a psychologist to diagnose the ADHD or adult attention deficit disorder, rather, and or attention deficit hyperactivity disorder. There are so many DSM-5s classifications, but some of us may need to see psychology first and then get sent to a psychiatrist who actually prescribes. Okay. So when I say psychology, I say this is a therapist who diagnoses you if you do have ADHD, and then sends you to a psychiatrist in order to prescribe medication and just like I'm veering off a little bit. Medication, I always say to people, are like shoes. It may be too long, too wide, too short, too narrow, but we have to try different things in order to find the right fit for you. So always think of medication that way. So I don't want to be chasing this rabbit. I want to get back onto adult learners, right? What was that? Age. So the the older we get, the more discouraged sometimes we get back into the game, I call it, to get back into education. But sometimes as we get older, we kind of realize how important it is, or we have been in one career and that wasn't the right avenue for us. And then we really get to learn what we really love, right? As we get older. And sometimes as we get older, we get a greater focus. So as I mentioned before, my oldest classmate was in her 50s. I think maybe late 40s to 50s. I really can't recall. But we really were so proud of her because she did not allow age to be a deterrent, as much as it was a bit difficult for her. But, she got through. And it was just an amazing thing to see that we all, the group that started out together actually made it to graduation. It was just the greatest accomplishment. So let age not be your deterrent, even if it means, sometimes again, age means, timing. Timing, which is my next topic of responsibilities. Age comes with a lot of responsibilities. Is this the right timing to do this? I have, as an adult, you have more responsibilities. You may be caring for an aging parent. You may have several kids already going to school. You may be the single mom. You may be the mom who's married, but with several kids and someone else, and a parent living in the home. There are so many different situations. You may already have a job that you may not necessarily like, but you want to do something else. Prior career, you went to college already. You're saying to yourself, do I want to do this all over again? So in those situations, timing is everything. The longer we wait, the more time passes by. I always say the only currency, the most expensive currency that we have is not money. It is time. Time is precious and it goes by fast, right? So the longer you wait to do something that you desire, the more time passes on and the more you lose interest. So take me, for example. I am in my late 40s. Here I am starting a podcast about nursing. We will talk about that at a later time, but it's something that I've always wanted to do, is to just reach people on a global scale where I don't have to necessarily sit inside a classroom, as much as I love to teach in person. But with everything that I do currently and holding down a clinic, being the mom of 2 boys, married, aging parents, just like some of you that I'm speaking to, there are a lot of responsibilities that may deter you or, make you shy of wanting to get into this and getting into nursing. So timing, you have to look at it as no better time than now to do what you love to do. If there's anything I see about getting older and getting to the midlife crisis, is not crisis for me at all, is doing what makes my heart sing. I always say that to people. It is always a good time to do what makes your heart sing. So, and the last thing I have for you, I think I already discussed that, really, is fear of the unknown. When you don't know what something has to bring, you are very fearful of it. So my recommendation to you is to try to learn as much as you can about nursing and not talk to just the people who are fried. Okay, that is not a good way to start. Is just, you want to hear the pros and the cons, right? Very important to hear the pros and the cons of nursing. And I had that as as something to talk to you about. So the pros, serving others. Okay. It is so internally rewarding to help someone get better. I don't know, you cannot put a price tag on that. And that's something that I always say to people, as much as nursing has provided me with so much, um, and there is a monetary aspect of nursing, but that is not the primary reason I went into it. And I think for many people who may drop out early is because, could be because that they've gone into it for the wrong reasons. I've always been that person. So if you are somebody who absolutely love to take care of others and also want to get into a rewarding field, nursing is for you. And making a change, making a tangible change in people's lives. You see someone that came in was feeling horrible, and by the time, even if it's not the medication that you gave them, I find that a large amount of the patients that I see, talking and being of support, being a counselor, can mean much more than the pill or the prescription. So keep that in mind. And of course, it is a very, very good paying profession. Could it be better? Of course, right? Especially for what nursing does. You may not agree with me, but I feel that we definitely should be paid more for what we do, because nurses go through some stuff. So some cons, people are going to say, well, it's not all roses, because I know somebody who's a nurse who's just overworked. There's all of that in nursing as well. The purpose of me trying to get more of us into nursing is because we want to work on this shortage that's been going on forever. And there are many reasons for that, as we'll talk about at a later date. But, if you just listen to those who have been burned out, and there are reasons for the burnout of the system, then you won't really understand the primary reasons as to why they got started in the first place. So, cons. One of the reasons why I started doing this podcast is because I feel that there needs to be more support in nursing, more support from start, middle to finish, especially when one is in school, especially for those adult learners, and those who, as I just mentioned, who have families, who have children, who may not have the support at home, who may not have somebody to kind of give them that push and say, you can do this, as I know you can. If this is you, no matter what anybody says to you, I know you can do this. It doesn't take somebody to be a genius, right? It takes someone to be willing to work hard. And I say nursing should never be easy. Why? Because you are taking care of people. You are caring for people at their most vulnerable hour. And you are also protecting people from harm. So it should not be easy. You should know all the meds and things that you need to know, how to care for them, how to advocate for them, so that no harm is done. And we never want to lose anybody over a mistake. So again, we are not perfect. No one is, but we try our hardest to provide all of our patients with the best care possible. Now, there are also bad actors, as I've talked about, but we're not going to be one of them. We're going to do this and bring it from the bottom of our hearts. So that's all I have for you today. It's been an absolute pleasure and speaking with you. I look forward to our next podcast. Please, for the YouTube people, look to the left or to the right, wherever they're going to throw this, our next episode, where we may be talking about the next topic in line, especially how to get the money and other topics that we have in store for you. It's been wonderful. You guys have a great one.